I'm Nicole Comstock, and I'm an occupational therapist. I've worked as an occupational therapist for the last 12 years, and I specialize with acute inpatient rehabilitation patients. I have my brain injury specialty certification for the last 5 years, and so I really like the traumatic brain injury population, but I've also worked with patients with strokes, cardiac episodes, cancer, and a multitude of other. Personally, I use the LightBridge app through developing routines for myself. I like to use the gratitude exercise as well as the arm exercises because all of us, could use more exercise in our life. So that helps me establish my own routines personally. Professionally, I use the LightBridge app to help my patients that I see develop those routines and help develop some consistency in their day-to-day roles that they need to take. The LightBridge app helps benefit my patients in establishing consistency and carryover of skills learned. It helps them develop those routines that they need to establish prior to going home. It helps them make them more independent with their daily cares and day-to-day roles. And it also helps their caregivers in establishing those routines and filling their time upon going home as well. The Checkin feature helps triage patients by making it more proactive instead of reactive in caring for their needs. It gives them a contact and an outlet to seek help at the point that they need help instead of waiting for that response and waiting and trying to figure out who to contact, when to contact, because throughout their healthcare stay, they've probably had so many different doctors, so many different appointments, so the app helps streamline their care that they need and the contacts that they need. Patients can use routines by establishing a preset routine that's already on the app and utilizing what's already there for you, or they can set up personalized routines that are more geared towards their specific needs. So they can utilize those routines in establishing what they need to do on a daily basis. So figure out what is important to that patient and then build those routines based on what they need to do each day to be successful. The LightBridge app helps provide peace of mind to me because it's a very easy resource and tool for patients and families to use when they're at home. Our biggest concern working in a hospital is that we haven't done enough to set them up for success when they go home. We're only with them for a small portion of their days, and they have to figure out how to do the rest. And so the LightBridge app gives me that peace of mind knowing that we have provided a resource and a tool for them to carry over what they need to do upon leaving our facility and going home. Advice that I would give to other healthcare facilities about the LightBridge app is to use it. It's very simple, it's very easy, it's very customizable for your patient's needs. This can be used with a variety of diagnoses, a variety of populations, and age groups as well. Teenagers through geriatric patients can utilize this app. They can use the preset routines that are already in there, or they can customize and have personalized routines that fit their lifestyle. You can set up medication management routines, you can set up wellness routines, you can just set up basic day-to-day functions like making an egg for breakfast, making toast for breakfast, brushing your teeth. So all of these resources are things that we try to teach them at the hospital and they need carried over at home.